My name is Tinley White, and this is my persuasive speech, and this is my audience. According to RehabNet.com, in Colorado, to receive drug and alcohol addiction treatment, it costs about $56,413. This cost would be for a 30 to 90-day inpatient program where therapeutic services, as well as basic necessities like food, would be provided for you. According to ZipRecruiter, the average annual income of a Colorado resident in 2024 was $56,726. It is unfathomable and unattainable that someone would be able to put their annual salary into only 90 days of care for themselves. The whole world falls short when it comes to helping those addicted to substances. The United States historically being able to adapt to other countries' ideas and systems could be the reason that more people lose their lives to overdoses in this country than any other. I personally have had the experience of going through treatment, and I was privileged enough to go to a place I felt safe, supported, and I didn't have to worry about the money. While there, we went to an Alcoholics or Narcotics Anonymous meeting every single night. For 6 months, I sat in a room every day and listened to strangers share about what they were struggling with. These meetings are for anyone with a desire to get sober or that is and is wanting to continue their sobriety. Those are the only requirements. People without homes, jobs, or families told their story with hope. Many addicts only have this hour of the day. They don't have a residential treatment facility, a psychiatrist, a therapist specially trained in addiction, or 90 days to take off of life. They deserve more than an hour. An article published through the Commonwealth Fund titled U.S. Overdose Deaths Remain Higher than in Other Countries, Trend Tracking and Harm Reduction Policies Could Help, opens the conversation of our country following in the footsteps of other successful countries. People are struggling and dying in our country simply because there are not many accessible resources. We can fix that problem, and we should. According to the Shatterproof organization, 49 million Americans over the age of 12 reported a substance use disorder within the past year, meaning 1 in 6 adults. Only 4.5% of those people received treatment in the last year. There are many reasons people are unable to seek support in a time where they may be experiencing addiction. The shame of the whole endeavor, not living close to a good treatment facility, or how much it costs. Treatment for substance abuse disorder itself is highly expensive with or without insurance. Most people will know that. What people don't consider is how much time you will need to take off of work. Having to reestablish a safe place may mean moving after completing treatment or living in a sober living environment. Medication to help sustain sobriety is rarely fully covered by insurance. All of those things, in addition to the cost of actual treatment, is suffocating the average American. In 2001, the Portugal experiment began, where this was the first country to abolish criminal penalties for recreational possession and use of drugs. The addiction epidemic is a medical one, not a criminal one. Through providing a panel of social workers, psychologists, and legal advisor to these people who were charged, they were provided a treatment plan instead of a charge, and the results speak for themselves. Merriam-Webster defines addiction as a compulsive, chronic, psychological, and physiological need for a habit-forming substance, behavior, or activity having harmful physical, psychological, or social effects, and typically causing well-defined symptoms such as anxiety, irritability, tremors, or nausea upon withdrawal or abstinence. From 2001 to 2006 in Portugal, HIV infections and fatalities caused by heroin and other drugs declined by 50%. Illegal drug use by children in middle school dropped from 14.1% to 10.6%. And the amount of lifetime use of heroin in 16 to 18-year-olds went from 2.5 to 1.8. With crime rates dropping, money was being saved and circled back into helping more people facing addiction. To decriminalize all drugs in the United States would be an unimaginable thing to happen. But what if citizens charged with recreational amounts or intendance of use received a treatment plan instead of a fine? If at the first time someone is seen to be headed in the wrong direction, they were offered help instead of a punishment. Switzerland and Norway are also countries that have taken a health and barrier-removing related approach to addiction. The number of deaths related to opioid overdoses dropped 64% in Switzerland over the last 2 decades. Norway's opioid against treatment program has very high retention rates, with 66% of people still in treatment after 18 continuous months. Government support has shown tremendous success in other countries for people struggling with addiction. Here's what we can do. We can vote in local, state, and federal elections. We can read and research what we are voting on and who it affects. I encourage you to do this. Look into who is running for office and what they stand for. With enough like-minded people running our local, state, and federal governments, there could be a change. We can also educate ourselves. Addiction is widely known as a taboo topic, but it shouldn't be. It's a public health epidemic. There are AA and NA meetings at all hours of every day, online and in person. You can buy Narcan at Walgreens without a prescription nationwide, and there are a handful of nonprofit or government-funded organizations in our state that provide free or low-cost treatment. There are people sitting in a circle in a basement church right now that deserve help, and other countries have implemented systems to help curb this problem for their citizens. We should be allowed that privilege in our free country. To conclude, in America, the private sector is commonly favored over a public one, which is what sets us apart from other countries. Without opening a conversation about politics from all of the evidence I've shown you today, I hope you've become aware of the changes we could take in this country to provide better access and care to our citizens. To review, I discussed why there is a need for more access to treatment for those addicted to substances, the successes other countries and governments have found with the implementation of treating this epidemic as a medical one, and provided 2 ways you can get involved. I spoke to you today to convince you why it's important that there is a change in the way our government in the United States treats and supports addicts. 1,631 Colorado residents died last year due to an overdose. You've heard it before, but I will say it again. It could be your brother, cousin, best friend, or even you. Speaking from personal experience, there is enough time to get help no matter to what extent an addiction has progressed, and everyone deserves a chance to get well.